and today on Facebook, Twitter, and LinkedIn we will be talking about science and COVID-19. Therefore, it's my great pleasure to introduce our Chief Scientist, Dr. Soumya Swaminathan. Good morning.
Good morning.
Thank you for having time and taking time to talk to our social media viewers and audience. What is WHO doing on science and COVID-19? But first, would you like to explain to our viewers what is your role as a Chief Scientist in WHO?
Thank you, and good morning, good evening to all the viewers. As you know, the Science Division was created last year, so the position of Chief Scientist is a new one. Now, WHO, since its creation, is a science-based organization. It does normative work, which means that we develop guidelines and standards related to health for people around the world. And therefore, it's very important that this be all brought together within a science division. So basically what we do is, first of all, make sure that there's quality assurance around all of the standard setting, the normative work of the organization, which means that all the products that the different technical departments are doing are done in a standardized way, the way we collect data, the way we review it, the way we discuss with the experts and with a broader group of people, including the public. How do we do consultation? And then how do we put it together to make those recommendations? So there has to be a standard across the organization.
We are also fighting COVID-19 pandemic with science. What do we mean when we say that?
So what we mean is that when you're faced with something completely new, this virus we only heard of in the beginning of January. So it's a big unknown, a big question mark. You know, where did it come from? What does it do? What effect does it have on people's bodies? What is it clinically? How does it spread? How can we control it? What drugs do we know that work? And of course, then how do we ultimately control it in the long term, say through a vaccine? So all of these are unknowns. And that is why we say that science has to bring the solutions, because you need to gather the evidence, you need to do the research, you need to, for everyone to work together to come to an agreement on some of these questions. And so really, and science has moved so rapidly, so much. We can't believe it's only less than 6 months since we heard about this virus. But we know a lot, and it's mainly through the work of thousands of scientists. When I say scientists, it also means social scientists, behavioral scientists, scientists not just the ones who are in the lab doing the work, but really in those that are in the broader area of understanding biology and natural sciences.
Thank you, Dr. Soumya. Would you explain a little bit more, how do we engage and how do we work with the scientific community during the pandemic?
So the way WHO works in general is through our wider community of experts across the world. And as I said, these span from basic scientists who work on genetics to people who do clinical work, to people who do public health work, to people who do work in ethics and social sciences. So the way we operate is through expert groups and strategic advisory committees and groups. So depending on the area of work and the topic, you put together a group of experts, and this is now done through putting out a call for experts from around the world to apply, and then there's a process of criteria that we have to shortlist people. We also have strict conflict of interest policies, so that if you're a person who's working in a particular topic and you've been funded in that area, you have to declare that you've received funding for that area of work and from whom have you received funding. And then there's a committee that looks to see if that is fine for you to come and still be part of this committee, and then you declare your conflicts of interest. So we have hundreds of these expert groups that advise us, and the secretariat, there are experts within WHO, of course, in all these technical areas, but they don't make the final decisions. The decisions are made through these expert committees who look at all the evidence, who study it, and then who advise. A good example I can give you is the SAGE, the Strategic Advisory Group on immunizations. And they actually are the ones who make immunization policy for the whole world. And everyone, all countries follow that, and many of the agencies like Gavi, the Vaccine Alliance, they base their procurement of vaccines on the recommendations of SAGE. So that's just one example, but we have many committees like that that actually develop these guidelines.
Thank you, Dr. Soumya. I would just like to use the opportunity to invite our viewers to ask questions about science and COVID-19 on Facebook and LinkedIn through comment section. And if you're watching us on Twitter, please use the hashtag AskWHO. You mentioned immunization, and in February, WHO gathered hundreds of scientists around the world to discuss a research and development plan for a vaccine against COVID-19. So what was the plan they agreed on?
So in February, we had something called the Research and Innovation Forum for COVID, and this was again a few weeks after we heard about this virus. So what we did was bring together over 400 people from around the world, again scientists, experts, clinical, from all areas, but related to research on this virus. Many people connected virtually because they couldn't come physically to Geneva. And we developed 9 working groups. So one of them was on vaccines, but there were 9 working groups looking at all of these different aspects of this virus and the disease that I mentioned. And each one of them actually produced a document on what do we know about this area. And of course, there was less known and much more that was unknown. What are the important questions that we need to answer in order to, for us to control this? And they developed a roadmap. So we developed a research roadmap that covered 9 different areas related to the virus. And so these working groups that were developed in January and worked through the February forum and till now have all made progress. So what we're doing is at the end of this month, on June 29th and 30th, we reconvene this, probably more scientists now, not 400, but maybe 1,000 people, to discuss what have we learned in the last 4 months, what are the big knowledge gaps that we now have much more information on, what are the remaining big topics that we need to work towards. So we hope that we take stock and then we look forward again to the next 6 months on what are the priorities we need to work on. Now specifically on the vaccines, I think everybody is interested in knowing about vaccines. What we did at that time, early January, February, was okay, scientists are going to be coming up with vaccine candidates. What is it going to take, for something in a lab to actually get to becoming an injection that people can receive? And there are many steps, many steps. It's not easy. Vaccine development normally takes 10 to 20 years. So here we're talking about developing a vaccine in 12 to 18 months. But we have to be sure each step of the way that we establish that this vaccine actually works, which we call it efficacy, which means that it protects against infection, and safety. These are the 2 properties of the vaccine. It should be safe in the sense you do not want a vaccine to cause more problems than what it's supposed to protect against. And so you have to go through these different phases of testing, starting from the laboratory, from cell cultures, then you go into animals, mice, and some larger animals like monkeys. Then you go into humans in a small number of people, what we call a phase 1 trial, where about 20 or 30 people or 50 at the most are given this injection. Sometimes different doses are tried, and you look at them very carefully over the first few weeks to see what happens, both in terms of an immune response, because you want a good immune response to the virus, but also any side effects. Then you go to a phase 2, which is usually several hundred people. Again, you're looking at the immune response, you're looking at safety, you start looking a little bit at efficacy, and then you do a phase 3 trial, which is usually thousands and thousands of people, where you have 2 groups. One group gets the vaccine, the other group gets usually some other vaccine as a standard or a placebo injection, and then you wait and watch over a few months for people to develop COVID through natural exposure. And then you see how many people developed in the vaccine group, how many developed it in the placebo or the standard group, and also you are looking at side effects. Then you come to a conclusion on whether the vaccine is having protection and also safe, efficacious and safe. And then there are criteria by which you judge that. And that's where policy bodies like the SAGE on immunization will come in, because they will then look at all of this information and say, yes, this vaccine passes the test and can be recommended. And sometimes there are caveats. You cannot give some vaccine to elderly because it doesn't have a good response. Some vaccines cannot or should not be used in children till they are properly tested in children. So pregnancy is another one where we have to be very careful and make sure the vaccine doesn't cause damage to the fetus. So these are all the different aspects which need to be looked at. And so, as I said, normally this takes minimum of a few years, 4-5 years, but because we're in the middle of a pandemic, we are trying to compress this timeline, but at the same time not compromising on any of the scientific principles that I mentioned.
Thank you very much, Dr.